Doctor, if you are studying for PMHNP boards, do not treat scope and standards as the easy section you skim at the end. Doctor, this is where many questions hide the real test. Not what you know, but what the PMHNP is allowed, expected, and ethically required to do next. Doctor, use this high-yield checklist. First, separate scope from standard. Doctor, scope answers who can do what, with whom, where, when, and under what authority. Standards answer what competent psychiatric mental health nursing practice should look like. Doctor, on the exam, scope protects the boundary. Doctor, standards define the quality of care. Second, know the national benchmarks. Doctor, the American Nurses Association, APNA, and Psychiatric Mental Health Nursing Standards give the professional foundation. Doctor, but state nurse practice acts decide the legal detail. Doctor, if a question asks what a PMHNP may do, check the legal frame, state law, licensure, prescriptive authority, supervision or collaboration requirements, Doctor, and controlled substance rules. Doctor, third, use the nursing process as your clinical spine. Assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Doctor, in PMHNP questions, assessment comes before action unless safety is immediately at risk. Doctor, look for suicide or violence risk, substance use, medical causes, trauma, culture, supports, and social determinants. The fourth, use ethics to break ties. Autonomy respects informed choices. Beneficence acts for the patient's good. Non-maleficence prevents harm. Justice means fair care. Doctor, fidelity means keeping commitments. Veracity means truth-telling. Doctor, when answers sound similar, choose the one that protects safety using the least restrictive, most patient-centered option. Fifth, watch legal boundaries. Doctor, informed consent requires capacity, disclosure, understanding, voluntariness, and permission. Confidentiality is strong, but not absolute. Doctor, mandatory reporting, emergency evaluation, imminent risk, duty to protect, and court requirements may change the next step. Doctor, the exam loves compassionate answers that skip the law. Sixth, no collaboration. Doctor, PMHNPs lead and coordinate care, but do not practice in isolation. Doctor, scenarios may include primary care, therapy, pharmacy, social work, emergency services, families, schools, and community resources. Doctor, choose the answer that integrates care without abandoning accountability. Seventh, study cultural humility, not cultural facts. Doctor, avoid stereotypes, ask what matters to the patient, address language access, recognize bias, and connect symptoms to housing, food, safety, income, transportation, doctor discrimination, and support. Doctor, finally, decode most appropriate next step. Ask, is anyone unsafe? Am I within scope and state law? Have I completed the nursing process step that comes first? After which, answer is ethical, collaborative, evidence-informed, and patient-centered. After that is your checklist. Scope, standards, state law, nursing process, ethics, legal duties, collaboration, and cultural humility. To master that framework, and tricky non-clinical questions become much easier to eliminate with confidence.